I set off on a journey to go to med school to try to uncover the root causes for my sister's condition, which was lupus. So my son, he's born, and when he's born, there's several things that they typically do with children when they're born. They will take them out, as soon as they come out of the womb, they'll clean them up before they take them off to NICU, or to wherever the nursery clinic. And typically, though, they'll always make sure the baby can nurse before they take it off to the nurse's station. So now at this point, I'm a zoology major at BYU. I really don't know anything about humans. I only know about animals, so I really don't know anything. But I really enjoyed being with the medical profession because these were going to be my future colleagues, which I was excited about a few months entering into med school. So I was always excited about this. So anything that I could learn, I was always pulling it from them. But when my son is born, the head nurse cleans them all up, decides to try to get him to nurse. So this is what they do. They take Bryce, and they take him up to Heather, and they take him and situate him up to her left breast to see if she'll nurse, or see if he'll nurse. And he won't take to it. He just starts screaming hysterically, beet red face, screaming. They're trying to push his face onto her breast, and he won't take or latch onto the nipple to breastfeed. So they're trying this for a few minutes, and I'm just watching as a new father, not knowing what's going on. They take Bryce, and they decide to switch him to the other side to see if he'll nurse on the other side. And as soon as they flip him over there, he goes right to it. Goes right to it, starts to feed. And they let him do it for about 5 minutes. Then they take him off, take him to the other side, go to put him on there, and he goes ballistic, screaming again at the top of his lungs. Now, me, being the father, wanting to know what was going on, I said, "Why is he doing that?" And the nurse said, "Well, Mr. Artis, some babies are just born picky." And I said, "That's the stupidest thing I've ever heard." And she looked at me, and I was actually surprised that she was for real. I thought she was just kidding. So when she approached me that way, I just knew that obviously they believed this. And I thought in my head, you can't possibly believe that. And so I said it, you can't possibly believe that. All the nurses then turned their attention to me and then over to the OBGYN, who was still in the room. And he turns and looks at me, stops what he's doing, looks at me, and he says, "Mr. Artis, I've been in this hospital for more than 35 years, or in this profession for 35 years. We've delivered over 10,000 babies at this hospital. And there are some babies that are just born picky." And right away, right when this future colleague of mine, who I view as the most reputable person that I know at this moment in the medical field, when I realized that he believes that some babies are born picky, I automatically had a shift in my mind that they didn't know everything that we thought they did. Because in my mind, I think very quickly and things process very fast. But as soon as the nurse said, "Some babies are born picky, Mr. Artis," the first thought and visualization I had in my head was, what baby is floating around in the womb thinking about for 9 months that when I get out of here, I'm a right boob baby, I'm not a left boob, don't you even put me on there. It's just ridiculous. So in my mind, I was like, you can't possibly believe that. So when I said, "That's the stupidest thing I've ever heard, that's the dumbest thing I've ever heard," they took offense to that and then wanted to correct me and tell me that no, there are some babies that are born picky. But it totally didn't make sense. How in the world would a baby actually develop that way? I couldn't wrap my head around it. But that was the first thing. For the next 4 months of this kid's life, and even right when we're leaving the hospital from the nurse's station, the nurses tell Heather, my wife, "We don't know why he won't calm down, and we don't know why he won't nurse, but he's just been screaming all night long. They can't figure out how to calm him down. So maybe when you get him home in his element, he'll calm down." Which I thought was funny because since he's never been in that element, he's only been in the womb for 9 months. How does he know what that house is going to feel like? But we took him home anyway. So we go home. From the time we take him home, he does not sleep once for 4.5 months for more than 15 minutes. Now, this is our very first kid, so we don't really know how children are supposed to be, but we assumed that kids would sleep longer than this. But for the next 4 months, my wife journeyed to between 5 to 9, 5, 6, 7 pediatricians' offices, different offices, trying to determine why my son dealt with all of these problems. He screamed night and day at the top of his lungs, and when he slept for 15 minutes, you had to hold him braced up against your chest, and you couldn't let him move, because if you fell asleep or if he moved, he would jerk and just wake up screaming. It was awful. And of course, working 2 jobs and working at BYU, preparing for med school, this was very tedious and very, very trying on our whole family. But these weren't his only symptoms, so he was incredibly irritated and screaming all the time. Always crying, always colicky, they called it. So his abdomen was always distended. He was always reflux up his food and throw up his food. He never once had a bowel movement on his own for the first 4.5 months. I had to stick my little finger, put Vaseline or KY jelly on there and stick it up his rear end and then have him push out my finger multiple times a day for 4.5 months is what we had to do. So we took our son everywhere for the next 4.5 months trying to find answers to why it is that he was like this. And this is what we were told. Son, Mr. Artist, Mrs. Artist, your baby is just colicky. He'll grow out of it. This is normal. He'll grow out of it. Now, I do nothing different because this is my only kid. And me and Heather decided actually in the first 4 months, we weren't having any more kids. Because if it's this difficult, obviously we're not fit parents. That's how we felt. Well, obviously we're not fit to have a kid because we can't even handle the one we have. How can it possibly be like this? Anyway, they put my kid through every test you can think of. They did barium radioactive dyes. They make them drink a bottle full of radiation, run it through their gut, take multiple x-rays of it to make sure how it was digesting. All of which, all we were given in 4.5 months were excuses and 4 medications, all of which were some form of an antibiotic. And every time the medical doctor would come into the room, write out his prescription and give it to us and then leave without answering any questions, I would grab him and ask him, why are you giving my son this antibiotic? And he would say, well, because obviously your kid's sick. And I would say, how do you know he's sick? This is how he's been behaving the last 3 months or the last 2 months. Well, because when kids are sick, this is how they behave. And every child that we've seen in the last several weeks have had these same symptoms: colicky, constipation, screaming, not being able to relax or go to sleep. So we're going to give this antibiotic. It should work for them just like it worked for the other kids. And I said, but now we just argue with him. And Heather eventually asked me to stop going because it became so antagonistic between me and my future colleagues here, because I wasn't getting the answers that I thought we deserved and what we were looking for, because we weren't getting them. 4 months into the treatments for my son, he's given a 4th medication. When we give him this 4th medication from this last pediatrician, within 5 minutes he goes into a grand mal seizure, which is where he loses all control of all of his limbs. And Heather and I are both, we are truly freaking out because we don't know what to do here. We're the first time parents and we don't know what in the world to do. So I call the medical doctor up on the phone while this is going on, and I tell him what's going on. Do we need to go to the emergency room? Do I need to take him somewhere? Do you need to see him? What do I do? And he said, well, tell me what's going on. I said, he's seizuring out. Something's going crazy. He's flopping all over the place. We don't know what to do. We gave him that medication. He told us 5 minutes before he started doing this. What do we need to do? Do I need to take him to the emergency room? And he goes, that drug I gave you would have never done that. You must have done something. What did you do to your kid? So instantly it's turning from, I want your help, to now I'm now the bad guy. Now, I'm assuming he thought I was going to be mad at him or try to sue him or get him in trouble, but that wasn't really my purpose. I wanted some answers. So I slammed the phone down and was angry, and I decided, Heather and I both decided that at that point we were not going to give him any more medications. The medications weren't helping anyway, but if they're going to do that to him, we might as well just take them off of him. A couple weeks later, I was playing intramural football. I dislocated my shoulder, got referred up to a clinic up in Salt Lake, so we take the whole family up there because we only had one car. We all go up there. And in my second session of treatment, this was on a Friday, the rehab specialist who's doing muscle work on my shoulder asked me, Mr. Artist, is that your kid outside in the lobby? And I said, how do you know it's my kid? And he goes, well, when you were in here on Wednesday, when you came into the clinic, that baby was screaming. When you left, it left. Now that you're back, it's back out there. Is that your kid screaming like that out in the lobby? And I said, actually, yeah, it is. What's wrong with him? It sounds like he's in pain. And I said, oh, don't even ask. No one knows what's wrong with him. Nobody can figure it out. And he goes, well, if you would you please bring that kid back to this room? And now I thought, honestly, he just wanted to get my kid out of the waiting room to stop disturbing all the other patients that were possibly out there. But I bring him back. And when I get back there, he goes, would you please lay your kid down on the table? And I said, what are you going to do to him? And he goes, I'm going to see if I can figure out why he behaves this way. And I told him before he asked me to go get him the whole story of what we've experienced over the last 4 months and all of our frustrations. And so while Bryce is on the table, he starts to feel his neck. And I said, well, what are you doing? And he goes, I said, what is a rehab guy going to be able to do with my kid? And he goes, I'm not a rehab specialist. I'm a chiropractor. And I said, well, what in the world's a chiropractor? I had no idea. I'd never been to a chiropractor. And so he proceeds to teach us what a chiropractic is. And just for a few minutes. And then he says, if you would tell me something, I have a question. When I feel your son's neck, there is one vertebrae at the base of his skull that's out of alignment. That bone should be sitting under the skull like this, and it's rotated like this. And there's a bunch of nerves in your spinal cord that sits under there, that if it's turned that much, it would create a lot of pain. I think your kid's in pain. I don't think he's sick. And I said, yeah, right. I said, don't you think the medical profession, with all their amazing diagnostic technology and tools, that they could figure out that a kid was hurting? They've already done everything. Don't you think they can figure that out? If they can figure out lupus and multiple sclerosis and Parkinson's, don't you think they can figure out if a kid's in pain? And he said to me, Mr. Artist, how would they have known he was hurting? And I said, I don't know. If a kid's hungry, he cries. If he's sick, he cries. If he's in pain, he cries. So they have no way of communicating, so how would they know? And I was like, oh, okay. He goes, so I want you to tell me, was he born with forceps or with vacuum extraction? And I said, how did you know he was born with forceps? And they said, well, the only way you can separate this joint from the skull is by clamping his head, turning it counterclockwise, and actually pulling on that head with enough force to separate that joint and to misalign that first vertebrae in your spine. Which he then proceeds to tell us that the brain sends communication pathways all the way to everything in the body through that one bone in the neck. And it could create all of his symptoms, his digestive problems, his colic, his inability to sleep and relax, his inability to turn his head to breastfeed, which could have been the reason, is what he told us. And I was real leery of this. I was like, okay, so what are you gonna do? And he goes, well, if you don't mind, I would like to adjust your kid. Which I didn't know what that meant, but he took his one finger, stuck it behind his neck, and popped one bone right back into its proper alignment. And my kid went ballistic nuts screaming, more than he was a second ago, and I thought he hurt my kid, so we left the clinic, didn't pay for the visit, we were upset, we jumped in the car, took off. Now during this 4.5 months, we'd heard everything from every other parent. If you want to calm your kid down and get him to sleep, put him on a washer and dryer, put him in a car, run a vacuum, something. All of these things of which made all of his symptoms worse. So all those things did not work. So I knew put him in the car wasn't going to make it any better, but when we put him in the car, we're driving down the highway and he's screaming at the top of his lungs, and 5 minutes down the road, all of a sudden everything goes perfectly quiet, and his head hits the chest. And me and Heather are scared to death because we think the kid's died and we think the chiropractor killed him. So we pull off the emergency lane, jump in the back seat, start shaking him, and you know how when people are tired, their eyes will roll. You know, you can at least see there's some sign of life. He had none of that. It was nothing. The only way you could tell is if you could see his chest would move a little bit and you could feel the breathing coming through his nose. That was it. I mean, he was like out like in a coma, we thought. We thought he was in a coma. So we were scared, jumped back in the car, took off down to Provo, got into our apartment there in Provo, called the last medical doctor immediately to find out what we should do, you know, because my kid's in a coma. And this doctor, who was the last one who gave my son a medication that gave him seizures and told me it didn't, this same guy proceeds to tell me, you took your kid to a chiropractor? That's the worst thing you could have ever done. He could have killed your kid. So I slammed the phone down again and I'm like, why is it that this guy doesn't support, or why do they think it's my fault? Everything I do is my fault. So we decided not to trust anybody. We were just gonna see if he would stay asleep or whatever this state was. So we went for the first time in 4.5 months, put him in a crib. And he laid in that crib for 8 hours, and every 10 minutes we went in there and checked him to make sure he was still breathing. 8 hours later we go in there and he's starting to wake up. So Heather picks him up. We're all amazed he's not screaming because he's always screamed. Heather goes in and nurses him. He falls asleep while he's nursing for another 5 hours, wakes up 5 hours later. When we get him up the second time, Heather goes, I wonder if he'll nurse on the left side now. He had never, ever nursed on this left side. We could never get him to do it. So for those mothers who actually breastfeed, they know if you don't use it, you lose it. So she didn't really have anything there to actually suck on. She turns Bryce around, goes to do the breastfeeding, and he latches right onto it and starts to suck. It's very painful for Heather. She screams and yanks Bryce off of her, goes back to nursing on the other side. But then it was a big eye-opener to us that this guy in 2 minutes could figure out what was wrong with my kid, that the medical profession with $80,000 worth of medical expenses, which were insurance paid, $80,000 worth of testing, 4 drugs, and only seizures, got us. That's what the medical profession gave us. This chiropractor gave us 2 minutes, adjusted it, all the symptoms went away. At that point, I wanted to know how it is that that chiropractor knew what was causing my kid to be in this much pain and causing all of these symptoms. From that night on, my son never once was constipated again, never once threw up again, slept throughout the night. First night he slept 4 to 5 hours. After that he was sleeping 7 or 8 hours a night. He was very calm, never screamed again, never cried again. And at that point, life was really easy. In fact, we loved kids and always wanted to have 6 or 7 kids, honestly. But this first one, we knew we couldn't handle anymore. But for those of you who know my family now, we waited a year of watching Bryce be normal. And once we saw that normal was easy with kids, it was very easy, it was a breeze. We had 3 kids in 3 years after that. And every time we had a kid, we had a chiropractor in the room to make sure that as soon as that kid was born, that he was adjusted, aligned before we did anything else with him. Why? Because I was not about to take another journey like we did with Bryce. We had to make sure that didn't happen again. And Bryce still to this day has never had any of those same issues. He's 9 years old now, and all of our kids have benefited from the therapies that we do, but that's what got me into chiropractic school.